Now, pediatric hospitals in Philadelphia and also in Delaware, they're swamped right now with a surge of sick children. Most are dealing with the respiratory virus RSV, but there are also new warnings about a triple threat, and that includes the flu and a potential resurgence of COVID as well. Health reporter Stephanie Stahl is here to explain the spike of illnesses, a trifecta in a sense.
It is a trifecta, lots going on here. You know, COVID precautions that we had for the last couple of years reduced the spread of respiratory illnesses. Well, those precautions are gone pretty much now, and viruses are infecting a growing number of people, mainly children.
Pediatric hospitals, including CHOP and Nemours locally, are overwhelmed with sick children, like 2-month-old Luciano Velasquez, who has the respiratory virus RSV.
He just looked like he could not breathe. You could look at the rib cage and you could see his skin like pulling in as he breathed. They say that's a major sign.
RSV, respiratory syncytial virus, which causes cold and flu-like symptoms, is highly contagious, spreading quickly through schools and families. Megan's 2-year-old daughter also has the virus.
I was just really scared, didn't know what to expect. You know, I was scared to lose him.
The CDC says there were recently over 7,000 RSV cases in 1 week alone, the highest 1-week total in the past 2 years. In Atlanta, one pediatric hospital has a tent for the surge of patients. In Connecticut, they're converting playrooms into patient rooms.
The hospital is pretty much at capacity.
Dr. John Loisel, the head of the emergency department at Nemours, says they're juggling space and dealing with a lot of worried families.
How do parents know when it's time to bring their child to an emergency department?
They're breathing particularly fast, particularly hard. You're seeing them use a lot of the muscles in the chest to be able to take a full breath, and they appear that they are uncomfortable with their breathing.
Other than breathing support and hydration, there are no specific treatments or vaccines for RSV, which is usually not dangerous for most children. Doctors say prevention is the best medicine, with things like covering coughs and sneezes, wash hands frequently, and clean and disinfect surfaces.
And also, doctors say people should stay home if they're sick, and getting the COVID and flu vaccines will help reduce those illnesses. Now, with RSV, it usually runs its course in about 10 days, and it's not just kids. Adults can also get and spread RSV, so we really need to take precautions and be careful, because lots of virus is spreading now.
Yeah, so much out there. My goodness. Thank you so much, Steph. Appreciate that. We know 2 studies, meantime, they suggest that the updated COVID vaccine boosters may not be any better than the original boosters. The new